Here's a question, sort of forward-facing question for you, Dr. Nagasaka. What are your thoughts on TKI neoadjuvant studies? Do you expect complete pathologic response? Do you ever consider to use off-label targeted therapies preoperatively to make a tumor operable? And so let's think of that for ALK as an example for that.
Sure. So I think that is an excellent question. And I actually think that that is where the field is moving forward. There are clinical trials investigating the use of neoadjuvant tyrosine kinase inhibitors in different settings, including ALK. So I think the correct answer would be to investigate those in a clinical trial setting at this time. However, I will admit that I have a few patients that I've had extremely incredible responses to tyrosine kinase inhibitors to the point that, I considered local therapy, and sometimes that means radiation, sometimes that means lobectomy. And interestingly enough, I had a lady who had an excellent response, and her primary tumor basically halved. So I asked the surgeon to take her to lobectomy, and it was path CR. So I actually have seen a path CR with ALK TKIs.
I think that today, if someone had a resectable tumor, 3 centimeter upper lobe tumor with a hilar lymph node, and I knew there was an ALK fusion, I'd probably just go right to surgery. I don't know that there's a long-term benefit from the use of targeted agents. The question was supposing, could you convert someone that was not resectable to resectable? And I think that's pretty controversial right now. You expect high response rates, but we don't expect the targeted agents to be curative all on their own. So overall, if something's resectable today, I don't know that there's a lot of value for neoadjuvant targeted therapy versus just resection and then consideration of off-label adjuvant. But what's your opinion on that, Dr. Nagasaka?
Yes, I have that situation as well. Oh, and the case that I described was initially completely unresectable. Anyway, yes, there is also the study for adjuvant alectinib. That is supposed to be coming out soon, right? That basically is a very interesting one. So basically, these patients were randomized to post-op chemotherapy versus alectinib, and I think we are about to hear those results. And hopefully, it is a positive one. And right now, I don't have the courage to omit adjuvant chemotherapy just yet. So, in such cases where I've had patients post surgery come to me and I see an ALK and not an EGFR, if they qualify for adjuvant chemotherapy, I actually give them adjuvant chemotherapy because that is the current available standard. And then I have off label use, put alectinib on patients on alectinib. I will see what happens to the studies.
And can you clarify the question here? What is a path CR? What do you mean by that?
Oh, path CR means that basically, so in a lobectomy, whether it be like a left lower lobe, usually the surgeon takes out the whole lobe, and then the size of the tumor is measured. But sometimes, in a rare case scenario, even though you thought that you were taking out tumor and are taking out tumor that is seen on a CT scan or a PET scan, sometimes that area no longer includes viable tumor cells, and that is called a pathological complete response.